Intermittent fasting, particularly time-restricted eating, TRE, has gained attention not only for weight management but also for potential cardiovascular benefits. Popular media often portrays fasting as a heart-protective lifestyle change, claiming it can dramatically lower cholesterol, reduce blood pressure, and prevent inflammation. While the evidence is promising, a careful review reveals a more nuanced picture. TRE does influence heart health markers, but the effects are often modest, highly dependent on diet quality, and shaped by individual biology. Understanding what studies actually show helps separate hype from science and offers a realistic perspective on how TRE can be leveraged to support cardiovascular wellness. Research indicates that TRE can positively affect lipid profiles, particularly triglycerides and LDL cholesterol, though outcomes vary among studies. Several clinical trials have shown that participants who restrict their eating window to 6 to 10 hours experience modest reductions in triglyceride levels and improved LDL particle size, which can reduce atherogenic risk. HDL cholesterol often remains stable or may slightly increase when a nutrient-dense, balanced diet is consumed during the eating window. However, these effects are frequently influenced by overall calorie reduction and dietary composition. Participants consuming processed or high-fat foods may see less benefit. This suggests that TRE enhances cardiovascular health most effectively when combined with a diet rich in whole grains, lean protein, healthy fats, and fruits and vegetables. Blood pressure is another key metric affected by TRE. Several studies report modest reductions in both systolic and diastolic blood pressure among adults following consistent time-restricted eating, even without intentional weight loss. The mechanism appears to involve improved insulin sensitivity and reduced sympathetic nervous system activity during fasting periods, which decreases vascular strain. In addition, weight loss achieved through TRE, especially reductions in visceral fat, further supports blood pressure regulation. Although the changes are typically not dramatic, even small improvements in blood pressure contribute to long-term cardiovascular risk reduction, especially when combined with other healthy habits such as exercise, adequate sleep, and stress management. Inflammation markers also respond to intermittent fasting in meaningful ways. Chronic low-grade inflammation is a major driver of atherosclerosis, metabolic syndrome, and heart disease, and TRE has been shown to modestly reduce circulating inflammatory biomarkers such as C-reactive protein, CRP, and interleukin-6, IL-6. Fasting periods stimulate cellular repair mechanisms, including autophagy, and reduce oxidative stress, both of which help attenuate systemic inflammation. In some studies, participants following a 10-hour daily eating window for several weeks exhibited measurable reductions in inflammatory markers, even in the absence of significant weight loss. This suggests that TRE can improve cardiovascular resilience independently of body weight, though greater benefits are generally observed when fasting is paired with high-quality nutrition and consistent lifestyle routines. It is important to note that individual responses to TRE vary. Age, baseline metabolic health, chronotype, and lifestyle habits influence the magnitude of cardiovascular benefits. Morning-oriented individuals who eat earlier in the day often experience greater reductions in postprandial glucose, insulin, and triglycerides, which may amplify heart protective effects. Conversely, night owls or individuals with irregular sleep patterns may see smaller or delayed benefits if eating windows are misaligned with circadian rhythms. This highlights the importance of personalized fasting schedules, emphasizing timing and meal composition to maximize cardiovascular outcomes. Despite promising results, TRE should not be viewed as a standalone intervention for heart health. Its benefits are most robust when paired with nutrient-dense meals, physical activity, stress management, and sufficient sleep. While TRE can enhance lipid profiles, lower blood pressure modestly, and reduce inflammation, these effects are additive rather than transformative. Individuals with pre-existing cardiovascular conditions should consult healthcare professionals before undertaking extended fasting or strict time-restricted eating windows, particularly if they are on medications for blood pressure or cholesterol. In practical terms, a sustainable TRE approach for heart health involves choosing an eating window that aligns with personal schedules and circadian rhythms, typically between 8 to 10 hours earlier in the day, and focusing on high-quality meals rich in fiber, lean protein, healthy fats, and antioxidants. Maintaining hydration during fasting periods, Avoiding excessive late-night eating and pairing TRE with regular exercise can amplify improvements in lipid metabolism, vascular function, and inflammatory regulation. In conclusion, time-restricted eating offers measurable, evidence-based benefits for cardiovascular health, including modest improvements in lipid profiles, reductions in blood pressure, and decreases in inflammation markers. These benefits are strongest when TRE is implemented alongside nutrient-dense meals and consistent lifestyle practices. While TRE is not a miraculous cure for heart disease, it is a science-backed, flexible strategy that can complement broader efforts to support vascular health, metabolic efficiency, and long-term resilience. By separating the hype from the evidence, individuals can use TRE strategically to enhance heart health while maintaining a sustainable, balanced approach to daily nutrition and lifestyle habits.